Autism and ADHD tend to be underdiagnosed in certain populations, including women, individuals assigned female at birth, BIPOC individuals, the LGBTQIA community, and more. Let's talk about why there's such a high rate of underdiagnosis. The first reason is the bias in research and diagnostic criteria. Most of the research around autism and ADHD has centered on white male experiences, leading to this collective assumption in our society that neurodivergence can only look a certain way. Reason number two, high rates of masking. So many autistic and ADHDers mask, which means hiding their neurodivergent traits in order to appear more neurotypical or normal. They do this for reasons of survival and safety. And folks with additional marginalized identities, like being a person of color or a queer person, only adds to the reasons to mask. So, of course, their neurodivergence goes unrecognized or unseen for much of their lives. And reason number three, why we have such high rates of underdiagnosis, is that there remain significant barriers to accessing quality healthcare. It's already hard enough to find a mental health provider or therapist who is queer affirming, gender affirming, culturally affirming, or otherwise social justice informed and can work competently with individuals with intersectional or marginalized identities. So add on to that trying to find a provider who also specializes in neurodivergence and who is trained to facilitate assessments or diagnostic evaluations. And we can see why, based on these gaps in our healthcare system, folks with marginalized identities are falling through the cracks and not getting the care or the recognition that they need.